Hi everyone, today I am giving you information on the topic history taking. This one is the history taking part 2, in which I'll explain you about the chief presenting complaints. Now each and every person come to the hospital with some kinds of complaint. He or she have any kind of problem due to which he or she visit to the hospital. Okay, so these complaints are known as the chief presenting complaints. So it is very important for us to know that why the patient is coming to the hospital. So first one is the chief presenting complaints of the patient should be recorded in a chronological order with their duration. Always ask the patient that what is your problem. Always ask about the complaint as well as the duration. Since when you are suffering from this condition or this situation. That is the duration of a particular complaint. Common presenting ocular complaints are. Now these is the list of the complaints which the patient is suffering, and these all are the eye complaints. First one is the defective vision. Defective vision is a kind of vision in which you can say that there is not a normal vision, it's a kind of abnormal vision. Patient feels blurry, double, and any kind of defective vision. Means there is a defect in case of if the patient is seeing any kind of object, then there is a defect in that object while seeing. But actually the defect is not actual, the defect is present in the eyes. So this is a defective vision. Next one is watering and or discharge from the eyes. The patient complains that water is coming from the eyes and discharge is coming from the eyes. If you can notice here that this whitish is the discharge. Okay, so this one is the complaint of the patient. Sometimes watering occurs, sometimes discharge occurs, and sometimes watering as well as discharge is coming from the eyes of the patient. And we have to note down the duration. Watering and discharge since 2 days, since 2 weeks. Next one is the redness. Okay, any kind of redness is considered to be as a chief complaint. Okay, this was the main purpose of coming to the hospital, that the patient have the redness inside the eyes. Okay, so these are the complaints. Now move to the next one, asthenopic symptoms. Asthenopic means the tiredness is feeling of tiredness to the eyes is asthenopic symptoms. Next one is the photophobia. Photophobia means when the patient is looking at the light, he or she feels uncomfortable or a sensitivity to the light is feel. Next one is burning, itching, foreign body sensation. Burning, itching, and patient feels that something enters inside the eye. Okay, that is the foreign body sensation. Next one is pain. Pain, eye ache or headache. Okay, eye gets pain or headache. These are the two kinds of pain. Next one is deviation of the eye. Okay, deviation means squint. Okay, one eye is looking at another direction and the another eye is looking at another direction, and we feels that where the patient is looking, that is the deviation of the eye. Okay, next one is diplopia. Diplopia means double vision. Patient complains that the vision becomes double. If you are seeing here that a single spectacular as well as the book, this image is like that spectacle is present on the book. Okay, so if you are noticing here that two spectacles are seen and the two books are seen. Okay, so this is a retinal disparity in which the patient is not be able to see that where the specs is. He will guess the specs is there because two things are seen to the patient. That is a condition which is a double vision. Okay, things are single but the patient perceives the image as a double image. Next one is black spots in front of the eye. These are basically floaters. Patient complains that when he or she looks at the light or looks at the sky, he or she can see the black shadows. So these are the floaters. Okay, in front of the eyes. Everything is present inside the eye. Okay, so this one is the complaint of the black spots in front of the eye. These spots move in that direction in which we are moving our eyes. Next one is the colored halos and distorted vision. So this one is the halos. Okay, the light is sparkling here and the halos are seen around this. These are the halos. Okay, next one is, last one is distorted vision. Yeah, distorted vision. Okay, if you are noticing this last image in which you can see that till here it is simple. Okay, but when the patient looks at this part, the straight lines gets curved. This one is the distorted vision, that the vision is distorted from this side. Okay, so this one is the distorted vision, that at a particular part the image seems to be a different, that is the distorted image. Okay, so these are the chief complaints of the patient, and it is very important to take the proper history of the patient since when he or she have these kinds of complaints, then we will try to treat it properly. Next one is the history of present illness. Now any kind of present illness if the patient have, then we have to ask, the patient have to be encouraged to narrate their complaints in detail, and the examiner should be a patient listener. Okay, so here the examiner should be a good listener so that he or she can listen to the patient whatever he is or she is saying. While taking the history, the examiner should try to make a note of the following points about each complaint. Okay, always ask the patient that he or she tell his or her complaints to the examiner only. Okay, not to ask from the relatives. Okay, this will create some miscommunication in between them. If the patient is not be able to speak, not be able to understand, then the patient relative is supposed to give the proper history of the patient to the examiner. Otherwise, always ask the patient, always encourage the patient, always ask the patient that you please tell your complaint. Next one is mode and the onset of the duration. When these complaints get start, since when you are suffering, from this disease. Next one is severity. How severe is it? It was severe yesterday, it is severe today, or it is better today. Next one is progression. How it keeps on increasing. Okay, is it keeps on increasing or is it better today? Next one is a complement of the each symptom. We'll take out each symptom, which is the important, have to discuss everything here. Mode and the onset of duration, severity, progression, take the proper history of the patient, as well as we'll take the history of the current prescription. If the patient is putting some drops inside the eye, some ointment inside the eye, and taking any other medications, Ayurvedic, etc., take out the proper history of all these things with the current prescription also. History of past illness. If the patient have any kind of past illness, then take the history of that past illness. A proper history of past illness should be made to know. Okay, history of similar ocular complaint in the past. Any kind of ocular complaint in the past, for example, the dryness takes place in a lot of patients seasonally. In the summer season, the patient suffers from the dryness, so it is a seasonal complaint, or it is a similar ocular complaint which was in the past. So always ask the patient, is it happens time before. Next one is, it is especially important in the recurrent conditions such as recurrent corneal aberrations as well as the uveitis. Okay, so ask about the recurrent conditions of the patient, corneal aberrations as well as the uveitis, these diseases. History of similar complaints in the another eye is important in bilateral conditions such as uveitis, senile cataract, and the retinal detachment. Always ask for the another eye, is it happened in the another eye, or always it happens in only a single eye only. Okay. Next one is history of any kind of trauma to the eye in the past. Okay, any kind of injury to the eye. History of any kind of systemic disease in the past, such as these are the systemic illness. Okay, first one is the hypertension, which is a high blood pressure, which also affects the eyes. Okay, this is the systemic history of the patient, which is also related to the eye and plays an important role in the disease of the eye, or to know about the ocular health of the eye. First one is the high blood pressure, which is the hypertension, HTN. Next one is diabetes. Third one is asthma, thyroid disorder, heart disease, and history of any kind of drug intake. For example, if the patient has a diabetes since 7 years, so he or she can take the prescription 2 to 3 tablets a day for the diabetes. So it is very important to ask about the tablets as well as the duration and the drug intake. And any kind of allergy, if the patient have any kind of allergy regarding any kind of particular drug, it is again very important. Okay, so next one is family history. Efforts should be made to establish familial predisposition of the inheritable ocular disorders like. Okay, family history is again very important because some diseases pass on from the generation to generation, and it is very important for the family persons to know that if it is going on in heredity, if it is moving on from the generation to generation, then the family members can take the precautions of it. For example, congenital cataract, by birth if a patient has the cataract, then there are the chances that it will pass on to the generation. Next one, ptosis. Okay, so this one is the ptosis. if you can see here that the eyelid get droops. This one is the left eye and there is a drooping of the eyelid is coming down in the left eye, so this is a case of ptosis. Okay, P is silent here and it is a ptosis. Next one is the squint is basically a deviation of the eye. If you are noticing the left eye of the patient, then it is going inwards, so this is the deviation. It is the esotropia. Okay, right eye is the normal and the left eye has a esotropia. Next one is corneal dystrophies, glaucoma and refractive error. Let's see about the corneal dystrophy. This one is the cornea. As we all know that the cornea is a transparent part, but you can see these are the impurities present here. This is the corneal dystrophy. Okay, so next one is the glaucoma. Glaucoma is a kind of disease in which the pressure of an eye increases. Okay, so next one is the refractive error. Any kind of refractive error, myopia, hypermetropia and the astigmatism, these are the kind of refractive error. Okay, so it is very important to take the family history of the patient. It was all about the history taking of the patient. Thanks for your patience listening.